I am Sophie Williams. I'm a research data scientist at Barts Health NHS Trust, which is an acute health organisation. The aim of my project is to get people within our trust using all the different data we have available in the trust, specifically our electronic health record patient data. And this is to undertake their own analytics to support care and to understand their own patient populations better. A specific way we're doing this is that I've worked with the team to develop a detailed data set of COVID-19 patients, and we've been using some advanced analysis techniques, including natural language processing or free text clinical notes, to really get a good detailed data set. Something we've really learned when working on this project is that it's crucial to work with the frontline teams to ensure that the data set contains all of the required information for their own benefit to do local analytics as well as research, and that the data in the data sets make sense. An unexpected benefit from this project has been developing stronger ties between the clinicians, the researchers at our partner university, the clinical trials teams and informatics to share the benefit of using this real-world data at near real time. There's been a lot of good progress when everyone is focused on this set task, but there's a lot of work to do to keep it going as we move out of the kind of COVID bubble back to a normal world where people have other commitments and this may not be able to dedicate so much time to this task. Something crucial that I've learned has been how to communicate my work to different audiences, so people from different backgrounds, especially when discussing the problems and kind of new solutions to break down barriers. It's been really good to kind of get out of the detail to the more generic what the problems are, so better ways of communicating. Also, a lot of the workshops we're running have been good to boost confidence at discussing the projects to different kinds of people. It's been really useful for helping that. This dataset's been shared with the priority clinical trials where there's been appropriate approval, and this has been really good to free up research nurses' time from completing the same information in multiple systems so that they can focus on recruiting patients into interventional clinical trials, and so they can spend more time directly with patients, which is going really well. The dataset's also been used for numerous research projects thanks to a rapid approvals process we've set up, and it's supported multiple peer-reviewed scientific publications. We're also able to support when the frontline teams have new questions about trends that are going on, for example, the effect of these new variants that were coming out in coronavirus. So there's lots of things going on with it, which is really good. Success of our project's been really dependent on historic investment, both in training up the clinical teams to input lots of structured data into our electronic health records and make sure everyone's using it fully. But we definitely want to be able to share these data sets more broadly, which won't be possible until there's bigger infrastructure investments. So I'd really suggest that similar projects need to make sure they've kind of got these basic foundations in place. For example, a trusted research environment for people to be able to safely and securely access these data sets. Something we are learning for in the longer term is that it's really crucial to engage patients early on, to kind of tell them what their own data is being used for within the hospital, engage them and make sure they're happy with the kind of governance we have planned and why it's so beneficial that their data at a population level is used to support analysis.